How about for the family and caregivers? What are their benefits? Well, one of the biggest benefits, I would say, is the fact that resources and immediate support are available 24 hours a day, 7 days a week, including your major holidays. Hospice doesn't go to sleep. There's always someone there to answer the phone, to pick it up. And we have to kind of train our patients and families to utilize this. They're not used to this. They're like, well, it's bad, but we'll wait till 8 o'clock when we're not waking anybody up. We have people awake and on call and ready to respond. We provide that respite when the task becomes overwhelming or they just need a break. We're a sounding board for the family and caregivers, and we provide personal support for their caregiving experience. We can hear them, we can provide them a sounding board for when it's really tough, and yet they would never want to share that with their loved one. They get the support for their issues of grief and their issues of loss from the very beginning. And most importantly, at the end, when the patient has passed, they know that they've done everything possible to provide quality in the days that that patient, their loved one, had. And this is huge in the fact that they're able to move on, move through their grief, process their grief a little more easier than if they had more, well, what ifs in their life as a result of the care and management. What do physicians gain from hospice? Well, they receive assistance in dealing with very stressful conversations and with patients and families that are in crisis. And at this time of end of life, it can be very difficult. Everybody has an opinion of what should happen. There's a lot of discussion. There's a lot of phone calls that are occurring. And with hospice, we can help ferret that out so that the physician has a better idea of what the patient and family, how they want to proceed. We can serve as a resource for dealing with uncomfortable situations. As I mentioned, most of us in healthcare have not been trained on how to take care of people that are dying. And we will frequently get referrals from docs that say, would you go out and talk to this patient? I haven't told them they're dying yet. And they want us to be able to spring that news on them because it's just too difficult. You know, they may have had a lifelong relationship, and it's very difficult for them to accept the fact that treatments are no longer helping their patient. Also, for physicians, we can be a resource on complex pain and symptom management. You know, hospice, you have to remember, is only about 30 years old in this country, and the medical interventions for hospice are new and evolving. And daily, I'll have a physician somewhere in the country that comes up with a new way in working with a pharmaceutical company of using something that has never been used for that purpose or for that reason in hospice care. So our science is evolving, it's improving every day, and our hospice and palliative care physicians will have the most up-to-date information and knowledge in regard to that. And how about for the insurers? How does it help an insurer? Well, cost avoidance. And that happens most readily as a result of hospice patients are not entering the hospital frequently, which is usually what drives the highest cost of care at end-of-life care. Also, interventions that may not be helpful are not occurring because the patient family have been informed about the possible outcomes of those interventions and make better decisions in regard to their care and aren't apt to go after interventions that may not have a benefit for them. There's also improved satisfaction of the beneficiaries and their family with the insurer as a result of quality end-of-life care, and you have to admit we live in a very competitive environment in regard to people's purchase of insurance. So having hospice on board as part of their cadre of services is actually a good thing for an insurer as well. Well, for those of you that were hanging on to trying to figure out how to change that mortality, 100% mortality statistics, I have some very interesting news for you. Hospice may never be able to take away the fact that we all die for some reason in this life, but interesting research has shown that hospice actually prolongs the lives of those with a terminal illness. Recent research showed that the mean survival rate was 29 days longer for hospice patients than for similar patients who did not choose hospice. So somehow, I guess, having the support, having your pain and symptoms managed, providing support for the family, that buys about an extra month of quality life for patients and families that are facing a life-threatening illness, which is pretty darn good. So I'd like to close before questions with this quote from Dame Cicely Saunders, as you remember, the founder of St. Christopher's Hospice in London. And she said, "You matter because you are you. You matter to the last moment of life, and we will do all that we can, not only to help you die peacefully, but more importantly, to live until you die." Thanks so much for this opportunity. Thank you.